what we're doing.
All right. So Kelly, go ahead and lie down, head on the pad there, and then you'll scoot up a little bit, get all the way on there. Your neck shouldn't be touching it, so just the head on there. And there's currently no resistance on that platform. So this is a nice way to work on stretching someone's neck, particularly if they're limited with rotation, which really is, the primary functional complaint that patients will have. Like, I can't turn my head to the left or right. I can't turn my head while I'm driving. So Kelly, what you're going to do is just turn your head left and right, and you're going to make that platform slide just like you're doing. So what's nice about this, and you can just keep the motion going steady the whole time. What's nice about this is it's in a non-weight bearing position. A lot of times when we're trying to get someone's neck stretched out and we're having them do active range of motion exercises, they're sitting or standing, and it's just less comfortable with gravity compressing. And so this is a nice way to work on range of motion in a comfortable way. And patients will usually respond to this pretty positively because it's easy, it's comfortable to do, and they feel like it's legitimate. Otherwise, you're wrapping towels around someone's head for some snags or something, and they just don't feel quite as comfortable.
That feels pretty professional.
Snag is I'll show you later. It's an active assisted range of motion exercise with the towel.
Yeah.
Yeah. So Kelly, that looks good. Now, some of your patients won't be as good as you, and they'll do a little bit of side bend as they turn left and right. So you might have to cue them to keep them, purely across the transverse plane, all that good stuff. So before we put on resistance, Ben, I'm going to have you be the PT, and I'm going to show you guys a couple manual techniques that you can do.
Okay.
Mike, you might have to rotate the camera around so that I'm not looking at Ben's back the whole time. Yeah, perfect. All right, Ben, so you're going to be at the head of the table.
Okay.
Swing around so you're at the top.
Oh, yeah.
Yeah, there you go. And then get the board right in the middle. There you go. Okay. So have you guys heard of rhythmic stabilization that we'll do for like the shoulder, for example, during shoulder rehab?
Heard about it. Haven't really done it before.
Okay, gotcha. So it's something that we'll do a lot for the shoulder joint, and now we can do it for the neck. So what you're going to do is you're going to be doing small, gentle perturbations of Kelly's head, trying to get her neck to move. And of course, her head is resting on this slippery, smooth platform. So it's going to want to slide around. And then Kelly's goal is just keep her head and neck perfectly in neutral. So Ben, you can try to side bend her with your hands, and you can try to rotate her head gently with her hands. And then Kelly's just going to meet your resistance and try not to let the platform move. Kelly, can you feel your neck muscles kicking on?
Yeah.
And when we do this, the cue is to have, like Scott said, have them meet your force, but don't beat it or overwhelm it to make it isometric. And the one thing to look out for with her is to make sure that she's not stiff the whole time. That she's responding selectively against the direction. Because I can see Kelly.
Yeah.
Just have them relax and then selectively meet the opposite of the force that you're giving.
I hope you guys know what a gem of a clinical instructor you got in Mikey.
Oh, he is a gem.
So does that feel all right?
Yeah.
For both parties?
Yeah.
Okay. And then you can, of course, do passive range of motion. So you can just have your hands on her head, and you're just going to gently turn her through her full rotation range of motion. And that's a nice way, if a patient's hesitant to move, if they're being guarded, this is a nice way to get their neck to relax, because they're going to feel supported the whole time. Something that you guys will start to notice when you're doing manual therapy, particularly for the neck, is a lot of times they're going to tense up because your hands are on their neck and they don't know what's going to happen next, and they feel like their head might get lifted off the pillow. But this is nice because it's going to stay weighted the whole time. So you can work on rotation range of motion, and then Ben, you can do side bending too. So you can work her through lateral flexion as well. So if they have any scalene tightness or anything laterally that you want to stretch out, I've had patients and PTs do nerve glides with this type of positioning. So Mike, like they would side bend right, and they do like a median nerve tension stretch on the upper extremity.
Yep.
go through that as just another additional motion. So let's throw on the headband. Let's do some strengthening exercises. So Kelly, this thing's going to want to slide on your hair. So you got to put it on nice and tight. Okay. The Velcro goes across the front of your forehead.
I think with this active assisted range of motion example, that's especially true of people that have small hands. When you have small hands trying to support someone's whole head, it's one of the most
It's hard.
valuable parts of their body. It's
Yeah.
hard for them to relax. So I think that's a perfect use for that. There's a lot of things to do with
And
it.
Mike, you're speaking from experience, right? With your small hands.
No.
That's for others. Okay.
Okay, think it's on nice and tight.
All right, Kelly, that looks good. So Ben, throw on the yellow band. So that just slots into that platform catch there.
Mhm.
Good. All right. So Kelly, the first thing to feel, rotation strengthening. So that same rotation that you were doing before, but now you have some resistance. So you'll just turn left and right. Now you're going to try to make that platform move as much as you can.
Oh, yeah. Sorry, yeah.
Just so you know. Next time you turn, I'll move your hair.
The other way.
Yeah, there you go. Kelly, your form's excellent.
Thanks. It is a bit harder.
I'll often cue the patient because sometimes they'll jut out their chin and go into a little bit of extension. I'll often cue them for a little bit of a chin tuck. And so they'll maintain that the whole time. If you guys haven't heard yet, the deep neck flexors are the physical therapist's best friend, and we harp on them a lot. And you get those guys going with holding a chin tuck. So for this exercise and for basically everything else I'll show you guys today, we want to maintain a little bit of a chin tuck.
Okay.
Feel good with that one, Kelly?
Yeah.
Good. So then I want you to feel an isometric hold. So this is something that we do in the clinic with usually someone sitting, and they'll actually do it to themselves, or they'll wrap a Theraband around their head. And this is a nice way to do it. It's going to feel a little bit more legitimate for the patient, and you're able to grade it. So you can put on the yellow band, red band, green band, blue band, whatever you need to make it hard to their level. So Kelly, you're going to lift your head up into the air, and with one hand, slide the platform all the way to the side. So with your hand, slide the sliding part all the way over, and then come down. And then you're going to let go with your right hand.
So try not to let it move.
And then don't let it move. Yeah, so you're going to stay in neutral there. Again, this is a good opportunity to cue for a chin tuck because they might be compensating with some of the more superficial neck muscles. And Ben, that's where you can see if they rotated out of the position or if they side bent out of the position. Come in with some cues.
I'm trying to keep it.
So if the full slide across is too much for patients, which does happen, I'll do like a half slide, so you can just go, not all the way with the board. So I usually have them do like a 10-second hold, and they'll do it a couple times per side. I've seen, in particular, one of the PTs in my clinic will do a 1-minute hold on each side. So she's a little bit more brutal. So yeah, you'll do that on both sides. And for the sake of moving on, slide it to the right this time, and then I'll show you the next exercise. There you go. All right, so now you're going to let the board turn you to the right. So look over to the right. Good, and then come back to center. Nice. So this is eccentric there, what she's doing, and then concentric as she turns back up to the sky. And this is just training the left rotators, so eccentrics. Mike, did you get a chance to try this one?
I did, yeah.
This is usually a crowd favorite.
Yep. And you can do side bending too, right, Scott?
That's right, yeah. So when you come back to center there, good. Stay there for a second. Now this one's hard. People mess this one up often. So Ben, you might need to come in there with some manual cues. Kelly, you're going to bend your head to the left. So you're going to bring your left ear to left shoulder, keeping your face up to the sky. Oh, she's nailing it. And then come back to center. I'm telling you, that's rare, folks. What you're seeing here is rare. Yeah, so obviously the left side bend, that's the eccentric for the right lateral flexors. And there's the concentric. All right, so those are all the big exercises to show you in this position. And then I just wanted to show you guys chin tucks. Any questions on any of those exercises, guys?
No.
I think
Pretty
so. No?
straightforward.
Kelly, how's your neck feel?
Good, it's working today.
Yeah. All right, you can sit up. And then, Ben, you're going to incline the head of that treatment table up a little bit. Just lift it up a tiny bit.
Just pull it up.
Yeah, perfect. And then you're going to orient the board parallel to the spine if they're lying down.
Does it matter which way? Or
Could you flip it the other way just so we can see the bands on the set? Yep. And then bring that guy all the way. Yeah, there you go. All right. Ben, do you want to be the patient now?
Sure.
Sorry, Kelly, your form was too good. We need to get someone else on there.
But here you go. Your own headband. Yeah.
do you want me to put this headband on?
Yeah, throw that guy on. Mike, can you turn the computer screen to the left a little bit?
This.
Opposite way. Yeah. There you go. Thank you.
Yeah.
Names.
All right, Ben, you're going to put your head at the very bottom of that guy, so your shoulders won't be touching it. There you go. All right, Kelly, can you take off that yellow band for him?
Yeah. How do you take it off?
Mike just took it off. We're good.
Oh, okay, gotcha. Okay.
Ben, slide up a tiny bit. Get your head a little bit more supported. Yeah, that'll move
Wait,
on.
hold on.
That good?
Yeah, that looks good. Okay, so have you guys given any of your patients the exercise chin tucks yet?
Not
I
yet.
haven't treated a neck patient yet. so-
Okay. Well, soon enough, you'll see that people really like to mess up chin tucks. And this is a nice way to prevent people from messing it up. So if you just tell them to tuck your chin and make the board slide back and forth, it's really hard for the patient to mess it up. But if you're doing that on a pillow, Mike, how many different ways have you seen somebody mess that up?
About 1 million.
So Ben, all you got to do is just tuck your chin and then come back to neutral. And as long as that board's moving, they're doing it properly. You really can't mess it up.
It was really easy.
So again, this is nice because the head's supported. They're going to feel comfortable. All the big players, the sternocleidomastoid, the upper traps, these are going to be able to relax, and then you're going to be able to isolate the deep neck flexors. So as soon as you feel comfortable with that, which you look great, now you're going to add a yellow band. So we're going to do some resisted chin tucks.
Yeah. Maybe try
So I like to do a little bit of a preload where I slide the board away from the patient a tiny bit. So Ben, lift your head up and just slide it just an inch towards you, Kelly. Yeah. And then you'll do the same exercise. So now there's some resistance to it. Kelly, is his rib cage flaring up each time he tucks his chin?
that. No.
Oh, very good. That's another thing you'll see sometimes is the origin of the deep neck flexors will be moving, and of course you want to stabilize that. So you want to make sure that they have a little bit of a posterior pelvic tilt. I'll often make them sit in hook lying so that their lumbar spine is against the mat, because otherwise you may see a rib flare each time they tuck their chin down. So those are the big exercises that I was hoping to show you guys. I'm very impressed with your guys' movement strategies. You guys are clearly going to be excellent physical therapists.
Thank you.
This is really cool.
Yeah. How often do you have to replace the Therabands?
So I recommend every 6 months. Now, what I've learned so far is that these bands last a lot longer than the ones against that cabinet behind you. For whatever reason, having them in your hands and the struggles of all that stuff in the clinic really wears them down. But with them in this device, I'm not sure the environment, I guess, is just more understandable, and they don't really wear out as much.
Scott, one real quick question. Have you run into any trouble with I'm thinking of the exercise in supine, like active assisted range of motion, rotation, like people of different body sizes, or like I'm thinking of someone with a little bit of a thicker torso and who sits with a little bit more forward head. Like Kelly was sitting in pretty much cervical neutral when she was there, but
Yeah.
what if flat isn't their neutral, if that makes sense? How do you recommend that?
Couple options. If you can get rid of it with just inclining the head of the table and putting it up on the head of the table, that'll work.
Yeah.
That'll put them in a little bit of flexion though. Otherwise, you can just go grab an AirX pad and put the AirX pad underneath it.
Yeah. Okay, cool.
So that's worked well for us so far.
Yeah.
Other thing is, some really young patients with a very flat thoracic spine, you might actually need to elevate their torso. And so I've put like a half foam roller underneath their spine to let their head be in neutral, if that makes sense. So doing the opposite of the AirX pad.
Yeah, good idea.
Yeah, and then cleaning it, I'm sure you guys know, you just spray it down like you do your tables, and you can do the same for the headbands. Just let those guys dry.
Cool. You guys have any other questions, or?
I don't think so.
Pretty cool, right?
Yeah.
Who
think you
thought of the name of it? It's
Yeah.
pretty good.
That's far.
I did a drive from University of Delaware to outside of Philadelphia every day for this residency. So that was an hour trip each day. And one day it just popped into my head, the word NecksLevel. And here we are.
Nice.
Had too much time on my hands.
Very cool. Good stuff, Scott. Yeah, if you guys don't have anything else.
No. Yeah, thank you very
Yeah,
much.
thanks for sharing
sharing
that.
us.
Thank you guys. All right. I appreciate the time, guys. Thank you.
Thanks.
All right, thanks, Scott.
Yeah.
Talk to you soon.
All right, Mike. See ya.